Have you ever sensed that someone you love is changing, but couldn't quite put your finger on what's happening? Many people believe that when the end of life comes, it happens suddenly. But the truth is, our bodies often send quiet, subtle signals, sometimes even a full year in advance, that life is winding down. The challenge is that these signs are easy to miss. They can seem like normal aging, small quirks, or just a bad week. But recognizing these clues early can make a world of difference. It allows families to prepare emotionally and practically. It gives you the chance to create meaningful moments, ease fears, and ensure that your loved one's final chapter is filled with dignity, comfort, and peace. In today's video, we're going to uncover 5 key signs that may quietly predict when a senior is entering their final year of life. Stay with us until the end, because understanding these signs isn't about giving up hope. It's about being ready to give more love, more care, and more presence when it matters most. Let's get started. Sign 1. Significant weight loss. One of the earliest and clearest signs that an elderly person may be entering their final year is unexpected weight loss. At first, it might seem minor. Their clothes look a little looser, their belt needs an extra notch, or they leave more food on their plate than usual. It's easy to brush off, to think, oh, they're just eating less because they're getting older. But unintentional weight loss is rarely harmless in seniors. When the body starts losing weight without trying, it usually means it's struggling internally. The muscles, which are critical for strength, movement, and immune function, begin to waste away. Nutrient absorption often declines. The digestive system slows down. Even the sense of hunger fades because the brain and body aren't signaling for food like they once did. And if underlying conditions like cancer, heart failure, or severe chronic illnesses are quietly progressing, weight loss can be one of the first outward signs. Families often try to solve the problem with extra snacks, favorite meals, or nutrition shakes. But if the weight keeps falling despite these efforts, it's usually a message from the body. It's conserving energy. It's shifting priorities. It's preparing. Instead of focusing on trying to force large meals, this stage calls for comfort, offering easy-to-eat foods, keeping them hydrated, and most importantly, maintaining emotional closeness. Because at this point, food is no longer fuel for living decades more. It's about small joys, small comforts, and creating precious moments together. If you've noticed significant, unexplained weight loss in your loved one, take it seriously. It's one of the body's most important early warnings, and it's telling you, now is the time to be fully present. Sign 2. Extreme fatigue and weakness. Another powerful sign that an elderly person may be entering their final year is deep, persistent fatigue, the kind that rest simply doesn't fix. This isn't just the typical tiredness we all feel after a busy day. This is an overwhelming, bone-deep exhaustion that makes even the simplest tasks feel like monumental efforts. Getting out of bed in the morning becomes a major challenge. Walking across the living room can leave them winded. Activities they once enjoyed, gardening, chatting with family, even eating, start to feel too draining. Why does this happen? As the body moves closer to its final chapter, organ function slows. The heart doesn't pump blood as efficiently. Circulation weakens. Oxygen and nutrients don't reach muscles and tissues the way they used to. And the metabolism, the engine that keeps everything running, downshifts dramatically to conserve what little energy is left. You might also notice they begin sleeping more during the day, taking frequent naps, or dozing off even in the middle of conversations. Simple things that used to give them joy, like a favorite hobby or a family dinner, now seem exhausting or overwhelming. Emotionally, this fatigue can be devastating. A once independent, lively person may start withdrawing from activities, friends, and even family members. Not because they don't care, but because they simply don't have the strength anymore. This is one of the most heartbreaking signs for families. It's tempting to encourage them to stay active or push through, but at this stage, rest is not the enemy. It's necessary. The best gift you can give is patience, understanding, and permission to move at their own pace. If you're noticing your loved one experiencing deep fatigue that no amount of sleep seems to fix, it's time to listen closely. Their body is whispering. Slow down, stay close, and savor these moments. Sign 3. Increase cognitive confusion or withdrawal. Another subtle but deeply important signal that someone may be in their final year is a noticeable shift in their thinking, memory, and communication. You might see little things at first. They forget the names of close relatives. They lose track of what day it is. They ask the same question multiple times in a short conversation. At first, you may brush it off as normal aging, but over time, the confusion becomes more frequent and more profound. Why does this happen? As circulation weakens and oxygen levels to the brain drop, cognitive function starts to decline. The brain, like every organ, needs constant nourishment. When that nourishment slows, thinking becomes clouded, memory falters, and even simple conversations become hard work. You may also notice emotional withdrawal. They speak less. They avoid social gatherings. They seem detached, even from the people they love most. It's not because they don't care. It's because their mind is slowly retreating inward. Loud conversations feel overwhelming. Complex emotions become difficult to process. And sometimes, even finding the right words can feel exhausting. Mood swings are common too. Some may become irritable, frustrated, or anxious. Others may seem unusually calm or indifferent to things that used to matter to them. For families, this can be one of the hardest changes to watch. It feels like you're losing the person you love even before they've physically gone. But remember, even if they can't always respond the way they used to, they can still feel your love, your gentle presence, your touch, your kindness. When a loved one starts showing more confusion, more withdrawal, or seems emotionally distant, lean in, not away. Speak slowly. Offer reassurance. Sit quietly if needed. Sometimes just being there, in peace, says more than 1,000 words ever could. Sign 4. Frequent infections and slow healing. As the body begins its final transition, one of the clearest physical warning signs is a weakened immune system. You may notice that a loved one who rarely got sick before now catches every cold, struggles to recover from even minor infections, or battles lingering coughs, urinary tract infections, or skin problems. What once would have been a simple cold now lingers for weeks. A small cut that should heal in a few days stays open, becomes irritated, or even worsens. This happens because as circulation weakens and organ function declines, the body can't defend itself the way it once did. The immune system becomes slower. White blood cells don't rush to infections like they used to. Tissues don't repair themselves as quickly. You might notice repeated infections, pneumonia, UTIs, pressure sores, appearing more often, and each time taking a bigger toll. And it's important to know, for seniors, infections don't always show up with obvious symptoms. They might not spike a fever. They might not complain of pain. Instead, infections often show up first as confusion, extreme fatigue, or a sudden decline in energy. This is why families sometimes miss the early signs, thinking it's just part of aging, when in reality, the body is struggling to fight back. Of course, it's natural to want to treat every infection aggressively, but at a certain point, especially in the final year, the focus often shifts from cure to comfort. Keeping the body hydrated, keeping skin clean and moisturized, making sure they're comfortable without putting them through more stress. If you notice that small illnesses are piling up and healing feels slower than before, it's the body's way of saying it's growing tired. During this stage, the most powerful gift you can offer isn't more medication. It's more love, more patience, and more gentle care. Sign 5. Major changes in breathing or circulation. As the body nears its final chapter, some of the most visible and emotional signs appear in how a loved one breathes and how their blood circulates. You may notice their breathing patterns change. They might breathe more slowly and shallowly. Sometimes there are long pauses between breaths. Other times, their breathing speeds up unexpectedly, then slows down again. One particular pattern called Cheney-Stokes respiration often appears. A few deep, rapid breaths, followed by a long pause where they don't breathe at all for several seconds. It can be alarming to witness, but it's a natural part of the body shutting down. At the same time, circulation weakens. You might notice their hands, feet, nose, or ears feel cold to the touch. Their skin might look pale, bluish, or mottled, especially at the extremities. This happens because the heart is focusing blood flow toward vital organs and away from the skin and limbs. A clear sign the body is conserving energy. Another common sign is shortness of breath during simple activities. Sitting up, speaking, or even just turning over in bed. You might see them breathing through their mouth more often, needing to pause between words, or preferring to sleep propped up because lying flat feels too heavy on the chest. Sometimes, families mistake these signs for a common cold or chest congestion, but fluid buildup in the lungs is common in the final stages of life and can cause a gurgling sound, persistent coughing, or difficulty breathing. If you're seeing these changes, it's essential to focus less on fixing and more on comforting. Keeping the room cool and well ventilated. Using a humidifier to ease breathing. Offering sips of water. Allowing them to rest in the position that feels best for them. Remember, at this point, the goal isn't to reverse these changes. It's to make sure that your loved one feels safe, cared for, and surrounded by peace. Breathing changes can be one of the most emotional signs to witness, but understanding what's happening can help you bring calm, reassurance, and love into those final moments. Final thoughts. Watching a loved one approach the final stages of life is one of the hardest journeys any of us will face, but recognizing the signs, like significant weight loss, extreme fatigue, cognitive changes, frequent infections, and breathing or circulation decline can help you move from fear to understanding. These signs aren't about giving up. They're about giving you the chance to prepare, to shift from fighting change to embracing peace, to focus on what matters most: love, dignity, and meaningful moments. To be present for your loved one in a way that honors their life. Remember, you don't have to do it perfectly. You don't have to have all the right words or the perfect plan. Just being there, offering comfort, showing you care. That's what truly matters in these final precious months, weeks, or days. If you notice these signs, take a deep breath. Slow down. Make space for laughter, for old stories, for simple hand-holding. Because in the end, it's the quiet presence, not the big actions, that leave the deepest marks on the hearts of those we love. Thank you for spending this time with us today. If you found this video helpful, please like, subscribe, and leave a comment below, sharing even one thing you learned or how you plan to use it. Your thoughts are important to us and help us continue creating thoughtful, compassionate content to support you during life's most important moments. We're here with you every step of the way.